Hello, welcome to Chapter 1, Part 2, where we talk about disease. And again, this is just an introduction, a lot of terminology. Get what you can, that would be great. When we talk about disease, disease is basically being at not ease. And it's a condition where your body fails from normal functioning. So you've got pathology, and patho means disease. So pathology is the study of disease, and then you have pathophysiology, which is the study of the abnormal body function, usually with disease. Now, when you look at disease, there's a lot of concepts and terms that I want to just introduce. We'll use them more as we go on. Etiology. First off, you hopefully realize ology means study. So etiology is the study of the cause of disease. Epidemiology is the study of the transmission, the frequency, distribution, and the control of the disease. Then we look at something called signs. Now, signs are, let's talk about signs and symptoms. A sign is something that you can measure. So it's your temperature, it is the color, it is the size. It is something where you can actually objectively measure it. So, and then we talk about vital signs. Vital signs are the main signs you start to take when we look at things. So blood pressure, pulse, your temperature, your respiratory rate. And as we go through different chapters, we'll look at what normal is for those. Now, a sign is measurable, where a symptom is how do you feel? So it's subjective. So do you have pain? Is it itchy? Are you dizzy? So that is it. That's a symptom. Usually the patient comes in with symptoms and then you measure the signs. And then there's often a definition of a syndrome. A syndrome is where you have signs and symptoms together, which make for a specific disease. Then what happens is the disease will then be diagnosed, and you will determine from the signs and the symptoms and the history, and usually the tests, what disease it is. So you've identified it, you've diagnosed it. And then you give the person a prognosis, which is the predicted outcome of the disease. It can be a terminal disease, which means you have death, a chronic condition where you have gradual onset but over a period of time, or it can be acute. It's rapid and it will rapid onset, and it usually dissipates within a few days or a few weeks. If there's a period without the disease, you can go into remission. You may have heard this term in terms of people having cancer. They don't show signs of it for a while, so it's in remission. Then it can come back, so you can have a recurrence of it or a relapse. Extubation is when you have a flare-up. Okay. When you look at disease defenses, these are non-specific. Well, there's non-specific. Your body has just because it's got a reason or a way to keep you healthy. When it comes to the non-specific, you have your skin, your barriers, and we'll talk more about these when we talk about skin. But basically, healthy skin will keep diseases out. Mucus is there to trap your disease. Then you have a chemical or cellular or chemical barrier, which is a specific disease defense, such as macrophages or enzymes, or you've got acid in your stomach. Then you can also have antibody-mediated response, which is when we talk about helper T's and immune system and antibodies. And then you also have cell-mediated. And we'll go into more detail on those when we get to the defense unit. When it comes to getting diseases, you can get it as it's a vector-borne. A vector means it's carried by another organism or another thing. It's biological. The example here is the mosquito and lice to some point. It's an infective insect which will spread the disease. You can be mechanical, such as on the surface, which spreads its disease. An example here is flies will land on something, pick up the disease, and then land on your food. Okay. You can also spread disease by direct contact, which you are touching body fluids, which touch you. And here's the big thing about hand washing, which I'm sure you will get into later. Or it can be indirect, such as you touched a doorknob, you touched a keyboard, things like that. So direct, you're actually touching the body fluid and you're putting it into an open wound, or indirect. Good. It can be on a common vehicle, such as in blood or food or something contaminated. It can be airborne in terms of coughing and sneezing. Now, when you think of standard precautions, think practically, and you'll kind of get the idea here. To stop the spread of infection, you wash your hands, and we'll get into more detail. You will take personal protective equipment, PPE. So you'll be wearing gowns, gloves, goggles, masks, face shields, whatever you need to in order to prevent it. This was really obvious when I went to get my teeth cleaned. The person had a mask on. She said more so she doesn't breathe on me, but really she didn't want to get what I'm breathing on her. Then she had gloves, washed her hands a lot. Some people even wear long sleeve shirts, so this way you can throw it in the wash. Things to look at. And again, as we go through it, we'll focus more on stuff like that. Okay, there's some standard precautions here. Read through them. You don't need to memorize them at the time, but as we go through, we'll look at how more serious things will have more serious precautions. Okay, and that's it for Chapter 1 and the lecture notes for Chapter 1.